Well, thank you very much and good morning. This is Flashpoint, the voice of national unity, and I'm David Coty. We're sorry about the delay because of a special event today that is going on. There is an OB out there. The president of Liberia is going to dedicate a program today. He's there. And so we are in the old department, the old place where we used to do our program. It's called the Metro. But we are still in the air. And we're still on our Facebook page. You can go to the Facebook page and watch us all over the world. We have 5,500 kids now. You know what I mean? You know what that means. 5,500 people are watching and following. And so today we have back in studio Dr. Moses Tarawali, a highly educated man, especially when it comes to the medical area. He's there with the Jahmale Medical Solutions as a family doctor. He's also the one taking care of the branch of the Jahmale Hospital or clinic there in Newtown, where I have done my medical checkup twice. And welcome to Flashman again, Dr. Tarawali.
Thank you for accepting our sitting down with you again.
Yeah, thank you.
Yeah.
We also have in studio Miss Agnes Anyele. She's a laboratory technician at the Jahmale Solution. Welcome for the second time.
Thank you.
So my brother and friend, this is his home. He's over
Thank
here. You. Yeah. Okay, I invited you back here today because we started our program the week before last, huh? Okay.
Maybe about a month ago.
A month ago, okay. Because we did not complete it, we still have some unanswered points. That's why I called you back. So please remind us about the topic and let's shoot.
Well, the last time we met, we talked about antimicrobial resistance. And what we mean by antimicrobial, it means any infection that is caused by either a bacteria, a virus, a fungus, a parasite. The medications that are used to kill them or to stop their growth are called antimicrobial. We talk about resistance. Resistance means that the bug or the bacteria or the virus that we used to kill, the antibiotic that was used or the drug that was used to kill that particular bacteria or fungus or virus is no longer able to do the work that it's supposed to do. So that is what we call antimicrobial resistance. How common is it? It is very, very common all over the world. In fact, WHO says nearly 5 million deaths occur from antimicrobial resistance per year. WHO also says it is the number one top global health concern for them. So it is a very important issue that we educate our population on what to do and what not to do. In a nutshell, that's why we are here, to do an awareness into what is happening in Liberia when it comes to the misuse and abuse of drugs. Not the ones at the Zogo stake. We're talking about drugs that are sold in the pharmacies.
Okay. Agnes, what would you like to add?
Okay, so it's great to be back again and talking back to the topic, a very interesting topic of antimicrobial resistance. We are going to talk more. Last time we were talking about female health, so we are going to dive into other topics apart from the female health that is really a concern when it comes to antimicrobial resistance. It's not just about female hygiene that this affects. It also affects other things like our malaria and even TB. Mm-hmm. So all this is what we are going to dive in this section, and it's going to be a great one.
Yeah, thank you. Before we go to other items or other topics, I want you to please go back to what we were on last week, or the last time you were here.
Okay.
Yeah, we can begin with Dr. Tarawali. We'll come back to you.
Okay.
Because that topic at the time was very, very great. And I think we should go back to it for a little while. Then we'll come to the new things that you want us to discuss. So please remind us. You can bring the mic down a little bit for him. All right. All right. Okay.
Yeah, last time we were here, we talked about what is happening in the Liberian sector, in the Liberian population, wherein people use antibiotics or medications inappropriately.
Yeah.
We also delved into the fact that sometimes because we are who we are, when we take medications for a particular thing for 2 days, when we feel better, we start taking it and we go and put it on the side. And we also, as who we are as Liberians, even though some of us are not doctors outside there, we decide that we want to be, backroom doctors. Wherein, for me, I took ampicillin the last time I had a cold and it helped me, the cold went away. So your friend complaining of cold in the neighborhood, you say, oh, go take some ampicillin because it helped me the last time. So these are things that are really, really affecting our population in terms of misuse and abuse of prescription drugs. I keep repeating it. It's not the drugs that the Zogos are taking we're talking about.
No.
We're talking about medications that are sold in the pharmacy where people, a 2-year-old who can walk and talk, can go in a pharmacy and say, I want lincomycin, and they give it to him or her. And a 90-year-old man will go there and say, I want propanolol for blood pressure, and they give it to him without looking for a prescription or whatever.
Yeah.
So we have to change our mindset in what we do in terms of drugs, especially medications that are used to treat infection and other things.
Thank you. Agnes, I think what Dr. Tarawali is talking about, what I'm thinking is this. Let's take, for example, malaria and typhoid have similar symptoms and signs.
Yeah.
Where you feel feverish.
Yeah.
But they are caused by different things.
That's true.
And they have treatment, the treatments are different.
Mm-hmm.
And so when you feel feverish, you just walk to the drugstore and say, I got malaria. You have diagnosed your own case. I got malaria. And the druggist or pharmacist wants medicine, money.
Yeah.
He doesn't ask you for the prescription from the doctor. He gives you malaria medicine. That's what you say you have.
Yeah.
He doesn't care. He wants his money. And then he gives you something for malaria instead of something for typhoid because he has not done the test. And so he does not know that typhoid and malaria have the same symptoms and signs, but they can be treated by different things. And so when you take that, I like the way Dr. Tarawali is putting it. He's not talking about the one Zogos take, Kush and this, that. No, that's not what he's talking about. He's talking about real drugs that can treat people, but you're taking the wrong thing for the wrong thing. So please tell me a little bit more.
Oh, okay. So in line with typhoid is actually very prevalent in Liberia. So it's something that is everyone often gets it. But the downline is that because there's easy access to antibiotics, you go in, you take any antibiotics to cure typhoid without testing. The first thing to do is you do at least a screening test. You have typhoid, IgG, IgM. The IgM will tell you it's a current infection, and IgG will tell you you've had it before. So there are differences in diagnosis. IgM, current infection, IgG, past infection. So if you are taking medications for IgG, you're actually abusing antibiotics. So back to the IgM. So with the IgM, even at that, you still have to go further with stool culture and sensitivity testing. Stool culture and sensitivity testing is a big word, but it's just to find out the particular bacteria and the particular antibiotics that would kill the bacteria. So it's very, very key when it comes to diagnosis to get the particular antibiotics, because you might be taking a generalized antibiotics and you make the bacteria tougher. Everybody wants to live, so definitely the bacteria also want to live. So you make it tougher for future fights. So the next time you are taking that antibiotics, it's not going to work. And I also want to just speak up a little about our females, the female health. You know, there's a notion in Liberia that every month when you are having your menses, you must take antibiotics.
Please break that down. The man
Okay.
said that's a period.
Yes.
When they're receiving.
You are
When they're
receiving.
receiving, huh?
Yeah. When you are receiving.
Yeah.
So every time you are receiving every month, you take antibiotics. Some people feel like you take antibiotics to reduce the pain. But there's no connection between pain and antibiotics.
Ah.
So every month you taking the same antibiotic. What it does is it wipes the good bacteria. Last time we
You
talked
said
about
it. And I'm
the
very
good-
surprised to know that they are
Yes.
good bacteria.
Yes, so that good bacteria maintains the health of the vaginal health. But it actually fights the invaders. So there are a lot of invaders in the system, the fungal, or a lot of other microbes that are not supposed to enter. The lactobacilli, that's the name of the bacteria, is actually there to defend the system. So if you are taking antibiotics, wiping your soldiers, what happens then? You have an infection that you keep curing. You will hear a lot of people say, I've taken everything, but I'm not getting well.
Ah.
So
So can you drive me away the soldiers?
yes. So what would fight for you? So the culture of taking antibiotics every month, I think it should stop. I don't
Even
think
after
it should
today.
actually to stop.
Even
Yeah.
after today, I will call you back to talk about other topics. We will come back to the same thing because it's bothering and harming a lot of people.
Yeah.
I'm surprised. I have invited more than 20 doctors here on my program, but this topic, hearing it for the first time. That's why I'm glad we're talking about it today, because it's very harmful. Most women don't know. Now look at what you're talking about. People are pregnant, they're receiving, and they're taking antibiotics because somebody said do so. Now they don't.
Some even take antibiotics because they want to prevent pregnancy. I don't know how it's connected, but
Oh.
but it's actually out there that if you want to avoid getting pregnant after you had unprotected sex, you take antibiotics. And it's a notion out there that they often do.
Yeah.
So you can imagine in a month, a particular lady might take like antibiotics 4 times. So
To prevent them from getting pregnant.
to prevent them from getting pregnant.
Can you imagine that? Dr. Tarawali, please elaborate a little bit more.
Well, the first thing is, like Agnes is saying, antibiotics are meant to treat infections that are caused by bacteria only. That's why they call them antibiotics. Antiviral are meant to treat viruses only. Anti-malaria are meant to treat malaria only. So the Locma, the Amodiaquine, the quinine, the chloroquine, they're just for malaria. And it's not every fever that is caused by malaria.
No.
What you said. Typhoid and malaria, typhoid and even Ebola, typhoid and COVID, they all get the same presentation. Sneezing, coughing, fever, headache, you name it. Some can even come with diarrhea. Some malaria will come with diarrhea or your stomach running. So if you don't go to the right place to do a good checkup, and you just walk into the drugstore or the medicine store or the pharmacy, I have a fever, and the pharmacists do wrong too in this country.
Yes.
And we need to highlight it.
Yes.
The pharmacist, you need to listen to us. You need to tell the person, did you bring a prescription? No, then go back to the clinic, get a prescription, we'll dispense the drugs to you.
Yeah.
Because even the Cipro that people giving, I told you last time we met, there was a young guy that was giving Cipro in Monrovia, and the guy developed Parkinson. He was trembling like this when they carried him to do so. We had to fight over that ball to bring him back to what he's supposed to be. Cipro is a very good drug, but even in America now, it's a back burner. They don't use it as it used to be popular because it got very bad side effects. Every clinic you go to, every small place, as soon as you say you get fever, they hang drip on you with with Cipro.
Oh.
And that is a wrong practice, and that is what is causing the problem everywhere in the world. It's not only Liberia. So what we're promoting here is not that we're trying to promote an entity. We're trying to address the issue about what is happening in our society that should be corrected.
Yeah.
Pharmacists drugstores, medicine stores, we all want to get well. Like that old announcement that we used to hear when we were small. We all want to go to heaven. But no one wants to die now. We all want to get well, but we must do it the proper way. And the proper way is going to a clinic of name or reputation, do your lab work, wait, even if it is a day, wait. You will not die in one day if it is malaria that is treatable now. You will not die in one day, or typhoid. Wait for that one day, get your report, then you are treated appropriately and adequately.
Yeah. And let me ask you something again before I go back to Agnes. I'm not trying to make the traditional people or medicines look bad. But what advice do you have for traditional doctors who don't really do tests? And when you tell them your problem, then they give you a cup of jolobo or something to take. What advice you have?
First and foremost is that we as doctors, nurses, PAs, lab investigators or lab technologists, even the people who do x-rays, ultrasound, whatever, we are all healthcare providers. We've gone to school and learned something about our field of expertise or whatever the field you belong to. For a country doctor, okay, I'll give you an example of myself. My late mother knew 3 medicines. One of them was, all 3 of them were common things out in our backyard, but nobody knew them. My older 2 sisters were pregnant. That woman went in the backyard and took some kind of medicine, chew it, rub it on their stomach, no stomach pain. They born their babies. I'm saying they say it's something I saw. So when they kept pushing me to go to medical school, I told her to show me the medicine. She said she can't do it because her grandma gave it to her, so that it's a law that only women she need to, and she never even showed it to my 2 sisters. The other one was for toothache. It was a common something out in the yard. My older brother, who our next door, had a tooth problem. That woman went and picked it up, put small in a tea kettle, boil it, give it to that man when it was cool. He put it in more, the tooth was extracted. And I'm saying they say. These things do work. But where the science disprove them is this. You don't have the chemical composition. You don't know it. We know what ampicillin is. We know what chloramphenicol is. We know what Cipro is. But ojolobo, you don't know what is all inside our ojolobo. The second thing is we know the dosage. Ampicillin, 125 for the children in the syrup, 250 in the syrup. In the tablet, they get 250, they get 500, sometimes they get 1 gram. You know the strength of what you are taking. The cup of ojolobo, you don't know what is inside. And to answer your question directly, when we were in medical school, we had a case of a woman from New Town who drank ojolobo and her kidneys were packed. Her kidneys were what we call renal failure, shut down. They brought her to JFK, and our professor sat us down for more than 1 hour to lecture us on herbs. Till today, I remember that lecture like it was done just now. 3 things country medicine can cause, and he named them. 1, it can burn your stomach. So we call it gastritis, inflammation in the stomach. 2, it can burn your liver. So we call it hepatitis, drug-induced hepatitis. 3, it can cause renal failure, can damage your kidney because the ingredients of that particular country medicine you're taking are dangerous to these 3 organs that he named. We fought with that woman, the woman survived. So we are not discouraging people from taking country medicine. If that's the only one you have in the interior that is difficult for you to come on the main road or come to a small town where they got the county health clinic or whatever, and it's a country medicine that you can take to get cured or get healed, go ahead and do it, but take it in a way that it will not damage these 3 things that I said. Take it in moderation.
In moderation.
Not a whole cup. I must say my tooth was hurting me a few days. I use salt and warm water. But I read about it and I tried it as an experiment on myself. And I can tell you, I didn't take any antibiotic. My toothache gone. Salt and warm water. I don't put it in my mouth.
Does that mean you're going to stop there, or you still see a dentist to look for?
If it comes again, I'm going to see a dentist.
Okay.
But the pain, I couldn't chew on my left side.
Okay.
Now I can chew on my left side. I don't feel any more pain. Put it in my mouth for 30 seconds, gargle it, and I spit it out. I don't swallow it.
Okay.
But some people will say, oh, because it helped me, I'm going to continue. I was saying, I'm giving myself an example. The next time it happens, I'm going to see Simon.
Yeah, even before the next time it happens, like you're really saying, I believe in medical doctors.
Yeah.
Go and see the doctor.
Yeah.
I was there last week. Oh, yes. I went to the Trinity Dental.
Yeah, with Simon, I saw that program.
Yes. And they cleaned my teeth, and there's a guy, I don't want to call his name, they extracted his molar. From, I don't want to call his name. He's somewhere around. They extracted one back tooth from there. Agnes, what are those new things you were talking about today?
I think Doc actually mentioned some part of it, and that is the different microbes we have. We have the virus, the parasites, we have the fungal, all of it. It comes with different symptoms. However, with antimicrobial resistance, what happens is that sometimes it's not just one microbe that is inside you that is pathogenic. You might have like 2 or 3. For instance, when it comes to fungal infection, you see that the fungal infection is an opportunistic microbe. So it has to you have to get rid of that fungal infection before you can be able to treat other infections. So if you go to the hospital and you have persistent infection, the doctor should go beyond what he's seeing. It might be an underlying infection like HIV that is dropping your immune system, or hepatitis that is actually dropping your immune system. So you fight the virus that is stopping your soldiers, then you go ahead with the other bacteria, because sometimes, many a times, with those who have persistent infections, many a times is an underlying infection that is causing the persistence, like them not responding to the antibiotics. For instance, HIV. If you have HIV drops your immune system. So if you are trying to keep taking antibiotics for a particular bacteria, it might not work until you start taking your retroviral drugs before it will work. So whenever you have persistent infections, you need to see a doctor. TB. TB is actually one of the very crazy bacteria. It can just change morphology, it can just develop resistance. So WHO keeps following up on TB. And TB, those who usually get TB are the HIV.
Oh, TB.
TB, yeah.
Tuberculosis.
Yeah.
So if you develop a cough, a fresh cold, and it's not going, don't keep going taking fresh cold medicine. Actually go to the doctor and explain and tell them, this is the length of time I've had this cough and it's not going. Immediately you tell a doctor that the length of time and I'm taking antibiotics, a good doctor will just click. There might be an underlying or an infection that is causing these antibiotics from not working. So they might open investigation on other infections like HIV or hepatitis. So this is a little thing I wanted to add from the last week's encounter. And last week's encounter was just about women. Women, which
was important.
It was very
because
important.
a lot of women are doing things to themselves today that are terrible.
Yes, it's very important. And always remember the women health, change your panties is very important.
Yes.
Change your panties. If you are always having infections, look at your health.
That was a very major point that I want you to talk about. And before you continue on that, let me inform the public that in about 3 or 4 minutes, we're going to open the lines for you to participate by calling 0777 511 977 or 0886 511 977. These are numbers you're going to call to participate. I'm sorry we're in a different environment today. Those who follow me always may not know we are here today, but I will still give it a try. 0777 511 977 or 086 511 977. Just talk about that. We're not going to take a break today. Right after she explains about the panty issue, I'm going to just say call down to ask them a question. We're in a new environment today. Talk about that panty issue a little bit. When did you say the other day?
Yes, last week we were talking about the common thing called fish. It's fish, right?
Yeah.
Fish.
Itchy fish.
Itchy fish.
Itchy fish.
Yes. That's fungal infection. So if you have a persistent itchy fish, every time you're having the same itchy fish, and the doctor keeps giving you antifungal drugs, and it keeps coming back. You actually have to get rid of the panties that you are using. It's just like you are giving me a cure of something, but I'm reintroducing that thing or that organism back to the system.
It's like you have back pain, a lower back pain that you doctors call lumbago. But you're taking the tablets, but then you're sitting for more than 2-3 hours every day. The back pain will not go.
So
how often should a person change their panty?
Ideally, if you can change it every month, is good. But ideally, because of the environment we are living, the money is hard and all that. At least 3 months. Every 3 months, you get rid of the panties that you are having. You burn it and buy new ones. It shouldn't be like the fancy ones. At least you have if you change often, even if it's the cheap ones, it's more healthier to maintain than you have the old nice ones and you keep having infections, repeated infections because you want a fancy panty.
It's not a good thing to have sex with people who are having itchy fish. Is that possible?
No.
Let me move to that.
No, it's not healthy, and it is good for people to know that once a man or a woman has some infection in either their toto or in their whatever you want to call it, stay away from sex. Even if you want to, don't use even condoms because condoms can also burst. So it's not healthy.
Yeah, but sometimes when a woman has itchy fish and the man is having sex with her, it helps her to ease the itchy fish. Yeah.
So you want to say that the act itself is a means of scratching your back?
Yes, scratching.
Scratching the person thing down there?
Yes.
No, it's not healthy.
It's not healthy.
Because what happens is this.
It will scratch it, but not healthy.
It's not healthy. What happens is this. The man himself is going to get it. And when the woman finishes taking treatment, he goes back inside there, he's going to deposit it back. So that's why we keep talking about recurrences. And most of us men don't like to go to clinics. We don't like to go to hospital. Few men like to go and do a wellness checkup and everything. That's why we're promoting, a healthy lifestyle. A healthy lifestyle involves you knowing what to eat, when to go and see your doctor based on your age and based on history of your family. If you have a family that has hypertension and diabetes or high blood pressure and diabetes, and you have a family that has stroke, or you have a family that gets cancers, various forms of cancer, breast cancer, ovarian cancer, prostate cancer for men, you need to go and make sure that you are not in line for those things by just going to do a routine check every now and then. Okay?
Let's take a few calls. If you're out there, 0777 511 977 or 0886. No, we'll come back to you. We might not even get many calls today because this is now a usual place, like over there. But let's try and see. So the good thing is that it's online and people will see. 0886 511 977 or 0777 511 977. If you're out there, please call and the doctors will talk to you and ask your questions relating to what we're discussing here this morning. All right, we can continue talking.
Yeah, something I wanted to highlight here is that The last time we met, we talked about it. How do this antimicrobial resistance spread? How does it spread?
Okay.
It spreads from person to person. It spreads in clinics, hospitals, because of either the linen that they're using, the bedpans that they're using, and other things that they're using in the clinic. It spreads in the community. We handshake. People have restaurants, people have kobo shop, lapabido, you name it, and there is not too much of regulation in terms of sanitation and whatever. So it spreads hospital, clinics.
How?
How? Bedpans for common. We don't use bedpans that much in Liberia, but they use them in the Western world.
Bedpan?
A bedpan is a pan that is used, okay, if the person can't get up and go and use the bathroom, okay? So they sit on it, the toilet, and pee-pee. Now, if you do not disinfect that bedpan properly, and then another patient go and use it, they're going to get whatever the person gets. Same thing like what happens in public toilets, public bathrooms. They don't disinfect them properly. So people go there. Women, most of the time, they don't squat. I mean, they don't sit on the commode seat. They squat or they stand up and pee, except if they want to toilet. Because the bathrooms are not clean in high schools, in various public places properly.
In fact, they use pit latrine.
Yeah. So you get, pit latrine is even better because it's waved down.
Okay.
Okay, but the commodes that are common, like the ministerial complex, various places, common places like SKD, okay, where you have restaurants, where you have frequent flyers, people passing through every second, every minute, every hour, you will have infections being left in there. And if you don't disinfect those areas properly, you're going to do that. Even in homes, where you have one bathroom in a house that contains 7, 8, 9, 10 people, you're going to have spread of infection there. Because when I leave in the bathroom, I might not clean it properly, somebody else might go and sit down there and pick it up. So, hospitals, homes, communities, we do not throw our dirt. We leave dirt anywhere. Waste disposal is not properly done. Okay? Then the inappropriate use of antibiotics, we go and get any antibiotic anywhere at any time. So those are some of the things that I want to highlight here. The organism themselves want to survive, like Agnes said. The same way we as human beings fight hard to survive. Malaria used to be treated by chloroquine, just like this. When we were growing up, you take chloroquine, put it in a drip, that person sweat, that malaria gone. It came to a point the malaria parasite said, you know what? Since you won't came in, myself will fight. And they resisted the chloroquine. So that how the other medicines came in, amodiaquine, Locma, and nowadays Locma is becoming resistant in Liberia because we have abused it and overused it. So for us in our practices, what we do, most of us, is we do both the tablet and the injection for 6 days. You do 3 days for injection, 3 days with the tablet, and you're able to combat the resistance that you're getting. But these are important facts that we need to know. That the bacteria, the viruses, the fungus, the TB, the parasites, even the ordinary worms, the parasites in malaria, they want to survive, so they're going to fight to survive. And therefore, they find mechanisms or ways. They produce enzymes, water or something that can eat the medicine that's supposed to kill them. The channel that the medicine is supposed to take to enter them and kill them, they can block that channel or change that channel. So the medicine come and hit a wall and can go in. Or when the medicine gets inside them, they say, okay, no problem, we'll pump it out. They use pumps to pump the medicine out. So you have the medicine in the system of the bacteria,
just 1 minute,
but it dies.
Hello? Hello, how are you? Okay, you want to participate in the program? Okay.
So those are some of the mechanisms that they do. And now, in the Western world, even good drugs, they have resistant strains.
Let me come to something quickly.
Okay? So,
Agnes, do you have numbers that you can call for the public to get to Jahmale if they want to ask some questions?
Yes, we have our numbers. If you want to get to the lab, it's 088 160 3050.
Okay.
088 160 3050. If you want to speak to the nurses, you want to book an appointment, 088 160 3037. 088 160 3037. So, but you just want to make a general inquiry, you don't know.
Yeah, please repeat those numbers. We're going to pin them on the Facebook.
Okay.
So please do them slowly again. Start with the first one.
088 160 3050.
That's the number for the lab.
Yes.
So for the clinic, 088 130 3037. That's for you get a nurse who will respond to you.
Okay.
Okay.
Is there another number?
Yes, as for general inquiry, you have 088 160 3000.
Please repeat that.
088 160 3000.
Okay.
You got that?
Yeah.
Okay. So I wanted to talk about how serious we've been talking about the AMR, how it affects us, but how serious is it? WHO is trying to pace up with the production of new antibiotics, at least to battle the ones that are resistant, and trying to produce more antibiotics.
Okay.
But the rate at which the current antibiotics are getting resistant, like the current bacteria are fighting the current antibiotics, they are so fast that WHO cannot produce new ones very fast enough to combat those things. So when we think 10 years to come with this rate, what will happen is if you are going in for surgery, you might, even surgery will become a death sentence. Why would surgery be a death sentence? You know, surgery, you are opening you up, you are exposing yourself to the environment. Before you can open somebody up, you make sure the whole place is sterile.
Yeah.
So now what you use to sterilize, if the bacteria are getting so
Used to
resistant to it.
This is a scary information.
Yes.
And
So it's okay.
Yeah, I won't cut you. I just want to read something that I copied from WHO. 2014, this is what WHO says. 2014, 10 years ago. This serious threat is no longer a prediction for the future. Antimicrobial resistance. That's what it said. This serious threat is no longer a prediction for the future. It is happening right now in every region of the world and has the potential to affect everyone, if of any age, in any country. I will read it again.
Yes.
This serious threat, antimicrobial resistance, is no longer a prediction of the future. It is happening right now. This was 2014. They said that. It is happening right now.
The WHO.
Yes. In every region of the world, and has the potential, it has the effect, it has the threat to affect anyone of any age in any country. Then in 2018, they said again, consider antimicrobial resistance to be one of the biggest threats of global health, food security, and development.
Now, what I want you to do for me, Doc, you talk about antimicrobial resistance, big medical term. Please break it down for us.
We said it from the beginning, the last time we were here.
Yes.
Antimicrobial. Anti means something against. Microbial means a bug. Not the one that can be flying that will go, oh, look at the bug, we'll kill it. No. We're talking about either bacteria, a fungus, like dishcloth, ringworm, the thing that can be hair kingy, the thing that can be between our toes, the thing that can be between our legs, you know, that's fungus, dishcloth, hair kingy, ringworm. We're talking about TB, okay, tuberculosis, dry cough that making you to lose your weight. We're talking about viruses, okay, HIV, hepatitis, you know, herpes simplex.
The point I'm making, thank you for explaining some of those diseases. Are you saying that the WHO is saying that as of now, certain medications can no longer treat some of those illnesses?
Yes.
Hey. And are they saying that there's nothing they can do about it?
There is something they can do about it by letting us become the public. What I mean by us become the public, we as health clinicians, we as healthcare providers, start doing awareness, educating our people out there on the misuse and abuse of drugs. Even we as clinicians will make errors. We prescribe drugs that we're not supposed to prescribe for people because we want quick money. Not everybody that comes to you and say, I got fever, you think about Cipro drip, anti-malaria, and give it to them. Like Agnes has been explaining, if you get a person Cipro drip, 3 Cipro drips, and the fever don't go away, you give anti-malaria, the fever don't go away, think about something else, think outside the box. Can this be the person has what we call fever of unknown origin? Fever that is more than 14 days. You do everything, the fever can go away. Can it be cancer? Cancer can cause fever. Can it be HIV? HIV can cause fever. Can it be hepatitis, B or C? Something. Can it be TB? So you look outside of the box. But as soon as the person comes, oh, that typhoid, you put Cipro drip, you put it there. The person comes, they got itchy fish. You have not investigated them, how many times they have gone to various centers and be taking antifungal to cure this thing and it can go away. Then you say, okay, go buy diflucan, go buy canesten, go buy this one. Insert for 1 week. Don't have sex during that time. Bam, bam, bam. Then they come back to you after 2 weeks and say, about that, the thing dry, but they came back.
Are you also suggesting that if the case is diagnosed by a medical doctor and the correct medicine is taken, it will work?
Yes.
So it doesn't mean that those viruses or bacteria have built up resistance in a way that...
No. I want to cut it off.
Yeah, go ahead.
What I'm saying here is that if you go and get the appropriate antibiotic or the antiviral for a particular illness, that you get a particular bug, that the doctor knows that this is herpes simplex, and take acyclovir or filmcyclovir for the suppression and this, that, you can control it. Okay? But if it is herpes simplex, for example, as a virus, then I tell you, go and take tenofovir. Tenofovir will not work on it. Or go and take lamivudine. Lamivudine will not work on it. Lamivudine is an antivirus, but it is used for a particular virus.
Yeah.
That's what I'm saying.
Okay.
Do the appropriate thing as a doctor. Follow the guideline.
Thank you.
Something that's ought to be for hepatitis must be for hepatitis, and something that's ought to be for other things be for other things.
I was afraid, but I'm okay now. Okay. Before you come in, I'm getting happy now. I was afraid. Because the point you're making is that don't just do the OTC thing, over the counter. Mm-hmm. Just go and buy, like we said from the beginning, malaria and typhoid got the same symptom. Mm-hmm. But you go and get malaria tablet for typhoid, it will not work. Yeah. But if you do the correct test with a medical doctor, and they tell you this is not malaria, but it's typhoid, and you take the typhoid medicine, it will work. That's what you're saying?
Yes.
Go ahead, Mama.
It would work.
That's what I am.
And at Jahmale, when we do our testing for the culture and sensitivity, we actually list out all the drugs, those that are resistant and those that are sensitive. So if you've been taking a particular drug and is resistant, you see it in our antibiogram that this is resistant. Even it gives the doctor a pattern. There are some bacteria that are producing some enzymes, like ESBL. Those enzymes actually fight some antibiotics. So if you have a bacteria that is ESBL producing, there are some drugs that will never work because they are working, they are fighting against it. So that's why we are preaching, do the appropriate testing. And also, I would just want to chip in on what Doc said about WHO. These quotes was said 2014, 2018. Yeah. Before COVID-19. Yeah. What COVID-19 did was it broke the system. The global health system was broken down. Everything went, everybody was trying to figure out what's going on. So you will not see any primary health doctor, you will not see any specialists. There were even queues. There are some countries that had long waiting lists. Because you want a quick relief. What people actually did then during COVID-19 was get the counter with antibiotics. And that That is what we are suffering now. 2018 was bad. Now
It was.
way worse than what it is, because COVID-19 made us comfortable drinking a lot of antibiotics because we don't want to get the virus. No one wants to get there. Those who want to travel don't want to be like quarantined. So we were taking the antibiotics.
Yes.
But it was actually killing our whole immune system and making things worse.
My guests today are Dr. Moses Tarawali, a former doctor at the Jahmale Medical Solutions. He's mainly based in Newcretown at a branch that is owned by the Jahmale Medical Solutions. And Ms. Agnes Anyele, the lab supervisor. And let's talk a little bit about the laboratory. You will repeat those numbers once more.
Okay.
And I hope that when we come out next time, we'll be back in our main studio. But let's talk a little bit about the laboratory.
Okay.
You are from the Jahmale Medical Solutions.
Yes, please.
Do you have an equipped laboratory that
Yes.
does a very good job?
Yes.
And what are some of those tests that you do there?
Okay. So we have an ultra modern lab.
I know you are laughing because you know I know that you have them. That's what I have done my medical checkup twice. I know you know that I know. But we're talking about the public.
Yes.
The public needs to know that you have them. So do you have a good laboratory?
I'll start by saying Jahmale Medical Solution is a NASCOP initiative.
Yeah.
So NASCOP saw the need for the population of Liberia not to be flying out of the country to
That's the
get
main point.
basic diagnosis or basic treatment. They want everything. Health is wealth. Health is one of the key things to economic growth. So they want everything to be
One
done.
of the key things or the first key thing?
One of the four.
One of the four.
Yeah.
Yes, one of the
But
key
even if
things.
it was the four, but I think it's the first. Once the help is not good, my friend, you finish.
Yeah.
The other four will not come. Go ahead.
So they saw it's very good to get a diagnostic center and a supporting clinic. So the diagnostic center houses both the imaging department and the laboratory department. The imaging department ranges for any type of scan that you want. You have the ultrasound, you have the CT scan, you have the MRI. The MRI is actually the only MRI in Liberia.
That I know.
Yeah, and it's an echo. Now we have
Fluoroscope.
in-house doctors that are a cardiologist. If you want an echo, a well-specialized echo, you have it in Jahmale.
Explain that for the echo. What does that mean?
Echo is like an ultrasound, specialized ultrasound
For
of
the
the
heart.
heart.
Oh,
So that ultrasound is best done by a cardiologist.
yes.
And we have
A heart doctor.
A
Yeah,
heart
a
doctor,
cardiologist,
yeah.
yes.
So we have a cardiologist in Jahmale that assists in that scan. So if you are doing a echocardiogram in anywhere in Jahmale, you have a specialist aiding in that
Station
process.
here.
Station, yes. And we have more interesting things coming up in the future. We have the fluoroscopy that is being installed. We will launch it very soon. The fluoroscopy, what it does is, the X-ray will just give you a picture, one picture, but the fluoroscopy will show you motions,
Yeah.
how it's moving.
It's a mobile X-ray.
Yes.
Let's put it that way.
So it shows you this is how this substance is moving in the bloodstream. I'm not a specialist with imaging.
Man, this.
So we are going for higher tech. I'm actually moving in line with the developing technology.
Let me just add to what she's saying about the fluoroscope. The fluoroscope is present time looking into what is going on in your body. So if they gave you maybe barium meal to swallow, in those days, without a fluoroscope, the X-ray technician will tell you swallow. Then he goes stands there and take a picture. But with the fluoroscope, the X-ray technician will tell you swallow, and then you see it coming out in real time. Okay, so you want to do a test for a woman that complains about not being able to born baby. We call it histosapingogram. You injecting the dye, and right there, the doctor who is doing it with the fluoroscope will see the dye going into the tubes, and will tell the woman, oh, your tubes are open or your tubes are closed. In those days, we'll do the picture later on, and then you come back, we'll look at the picture and say, okay, your tube's closed. What they want is real time.
On the spot.
On the spot, as we're talking, you're seeing it going on.
You have those machines there now.
The machine has been installed. So that's what we're
we'll
talking
be
about.
launching it soon. So let me dive into the laboratory, my specialty.
Yes.
And with the laboratory, we have a specialized lab. We have the different departments of lab. We have the hematology. With our hematology department,
It deals with blood.
blood. You see, in the blood, we have different cells. So the hematology department will count the cells, the number of cells. Based on the number of different cells, it tells you have viral infection, you have bacterial infection, or what is actually happening, or you have leukemia. So that is hematology, and also specialized hematology. HB electrophoresis for sickle cell. Blood typing is done in the lab department. And also we have the biochemistry. The biochemistry does, first the hematology does the cells, the biochemistry now does the substances in the plasma or the fluid part of the blood. Okay.
Sorry.
Okay. So with the biochemistry, we have liver function. We can check the liver function. We can check the renal function. We can check every nutritional parameters like iron.
You know, I'm so happy to hear that.
Okay.
I think we're going to find time to invite you people back here. You and Dr. Tarawali will come, but it will be merely about the lab.
Okay.
The reason why I'm saying so is that, like you mentioned from the beginning, the purpose of NASCA establishing the Jahmale solutions. Most people have died here because they did not have money to travel abroad. Even if they had the money, the risk is involved. If you had to go to Ghana or South Africa to do an operation or surgery, and you had to travel by plane, you know, like some of us, we're not used to planes. I have been to 17 countries, including the United States, but I'm not used to planes. No way. When I'm getting into it, my friend, my heart is hanging until I get there. So some people may even die because they don't want a plane ride. That height, I'm not used to it. Okay. So
Yeah, and even there are some emergencies that you cannot take place. For instance, you have an accident, an acute infection that you have spike liver. You know, before you even go into the plane, they will screen you.
The plane normally requires a certificate.
Yes, if you are fit to fly, and if you are in a chronic or acute state, you will not be fit to fly.
Can you imagine that?
So
all that has been stopped now by Jahmale.
Yes.
Because there I only knew about the MRI, which is the highest so far that Jahmale alone has in this country. Now you're talking about other issues. So you are coming back on the 17th of January. And on that day, you know, every month I have my list for who's coming. It's already set for January. You are coming, you know, I hosted, anyway, you are coming back on the 17th of January. And when you come back, it's merely about the laboratory.
Okay.
This country needs to know what you
Or
have.
the diagnostic area.
The diagnostic area.
Yeah.
That's correct.
Yeah.
Because the public needs to know what you're doing here and what you have here. So that's the next topic, the diagnostic area.
Yeah.
You
We'll be
will
looking
come
forward
back.
to it, to
Yes.
break down, because there's a lot.
As
So
you're
we'll
talking,
break down.
the professor will be
No,
coming in.
somebody else from the diagnostic center will come with her.
Yeah.
Yeah.
You
It'll
can-
be better that way.
Yeah, but you can also come. It's important. You can also come. If you'll be three, no problem, because we're going to be in there. But I'll suggest that you come. I know
Maybe one of the imaging people.
Yes, thank you.
Yeah.
Yeah. Yeah.
We'll be looking forward to that.
Yes. Yeah. That's the next topic.
Yeah.
I'll give you my topic now.
Okay.
I want the public to know what you're doing here, what you have here.
Okay.
So that people who something may happen to me, I have to be thinking about how to find money to go out there.
Even-
And the good thing is that it's far cheaper. If you do the MRI somewhere else, my friend, you're talking about millions, thousands of dollars.
Yeah.
And then here the MRI is around $400, $500. Not much. Yeah. Please close up. We're out of time. Let's start with you.
Okay. So it's a very nice discussion today. We are hoping to come back later and we talk more about our laboratory in the diagnostic area.
Yeah.
But just to wrap up, AMR is a very important thing that we need to focus on. Do not go and get antibiotics without a prescription from a doctor.
We'll keep talking about it.
And doctors, before you give any antibiotics, make sure you have the best antibiotics for that particular bacteria. Don't just give any antibiotics because you just want to treat faster and just get the patient out of your door.
Thank you. Thank you. Now just for 30 seconds.
All right. Like my colleague is saying, clean your environment.
Yeah.
Clean your environment. Do personal hygiene, infection prevention and control. Eat healthy. Exercise regularly. Last but not the least, this is very important. Those of us who are healthcare providers that are in the community, let us start doing public awareness with our neighbors. Don't just take antibiotics because your friends say go and take it. Or I took it and it helped me. There are different diseases, there are different antibiotics. So we encourage everybody to go to a well-reputable clinic, do the appropriate testing, examination and everything, get a prescription ordered by a clinician, a doctor or PA or even a nurse that know what they're doing. And then do not take antibiotics just because you want to take antibiotics. Do not take it for a short period of time, 3 days, and you say, I feel better. You stop. If they give it to you for 7 days, take it for 7 days.
Those are rebels.
Thank you.
They can come up with reinforcement.
Yes.
Please call those numbers once again. Let's close up on you.
Okay. So for the laboratory, 088
Go slowly, yeah.
160 3050. 088 160 3050. To get a nurse, 088 160 3037. 088 160 3037. For general inquiries, 088 160 3000. 088 160 3000.
Thank you very much, and let me say many thanks to you, Dr. Moses Tarawali and Agnes Anyele, for coming back here today. You have another invitation for the 17th of January. We're going to talk about the diagnostic area. I'm so happy and pleased to know that you have those things here that people are traveling abroad for. Some don't have the money to go, and when you're traveling, two many things are involved. Number one, the risks. You may remain in the air and go into the sea. You may get there. You have to find a hotel. You're not going alone. You're going one or two persons to take care of you. Hotel bills. And you have to eat every day. A lot of things will happen there. Nobody will cook like a salad for you and send it there. You have to buy the food from there. Too many things are involved. So, we need to thank God for Jahmale for bringing those things to our doorsteps. So thank you for coming, and we hope to see you next month on the 17th.
Thank you.
Thank you.
Bye-bye.
Thank you, sir.